What messages are you trying to convey with this flash mob experience, and is there a specific audience you are looking for?
I think that the flash mob that we are doing at the Riverview Tower Clinic is essentially trying to create awareness in the community for Care Alliance's presence and the services that we offer at Care Alliance, whether it be medical, dental, or behavioral health care. We really are trying to let folks know, young, old, different social statuses, economic statuses, that we are available to serve them in their community.
What message is the organization trying to convey in the general public?
I think our message is that really stands true to our mission, that we are a federally qualified health center that provides high-quality, comprehensive medical, dental, behavioral health care services to those who need them most, regardless of their ability to pay for treatment.
In previous years of National Health Center Week, is there any repeating challenges you encountered that you are trying to overcome with this year's event?
I wouldn't say that we've faced many challenges in National Health Center Week. It really is a week to take time to recognize the accomplishments of federally qualified health centers. However, I don't think that we have done quite as much in past years to really generate that community awareness that I spoke to earlier. It's an opportunity for us to take the individual focus days throughout the week, whether it be health screenings, addressing public housing, healthcare for the homeless needs, or really engaging our elected officials. And so this year we are ramping it up. We're working with the other federally qualified health centers in the community to host a conference, to do screening days at our clinics, and to really even launch some special projects like the flash mob and other social media campaigns to kind of create the buzz that we're looking for.
Are the services at Care Alliance Health Center exclusive to the homeless in the Cleveland area, or could a transient come from out of town or out of the state to receive services?
Our services are definitely not exclusive to the homeless in Cleveland. While we are the leading provider to serve the homeless for medical and dental and behavioral health care needs, alongside some of our partners like Frontline Services and Enterprise, we work really hard to serve that population, but what you will notice when individuals come in to the shelters is that there is a transient population. You may have somebody from Texas who's arrived on the bus in Cleveland today and has completely shifted and altered their life and now are looking for services and help. The shelters are oftentimes the first place folks stop when they come from other areas, and so we are there to help them and make sure that we get them set up here in Cleveland with what they need, whether it's permanent or if it's just in the temporary time.
Opportunities are available for college students seeking to do an internship with Care Alliance Health Center.
So Care Alliance is really proud to be able to offer internship opportunities to college students. In particular, we work with the CSU and NeoMed programs to place their medical students in our clinics for year 1, year 2 rotations. We've also worked with the universities like Case Western Reserve with their dental students doing a similar clinical rotation experience. And then beyond that, we like to take opportunities to work with public health administration classes, business communications classes, masters in business and accounting, to really do some deep dive forensic analysis of our accounting operations, or to work on special projects to create awareness about targeted campaigns, whether it's infant mortality issues, the opiate epidemic, National Health Center Week, for example, what we're working on today, or even doing targeted education like lead awareness. We've also got opportunities for community health workers in the Cleveland area, and always looking to expand if there's a right placement and a right fit. Sometimes we do special events like our Let's Talk Turkey event in November. It's our annual fundraiser, and we're always looking for volunteers and interns to help on the event planning and administrative side. So we have lots of opportunities. Just reach out to us. There's information on our website to apply to volunteer at Care Alliance.
What type of competitive advantage does your organization have to offer?
I think what makes Caroline's so competitive in the Cleveland Health Center community is our special designation to serve the homeless population and the public housing population. As a federally qualified health center that receives funding to serve special populations, we're doing something right with those populations. We've been rooted in healthcare for the homeless for 30 plus years now, and our providers are well trained and educated to treat the unique barriers and unique healthcare needs of individuals who are struggling with homelessness or who have low income and potentially living in environments that aren't necessarily conducive to treating your healthcare needs on a daily basis or even on a preventative level. So,
on the back of your annual report, you list your sponsors. How do you acquire most of your sponsors?
I think that most of our sponsors are long-time sponsors, for starters. They've been supporters of Caroline's from the beginning, our inception, and so they have a strong sense of pride and support for our mission, and they oftentimes will become advocates for Caroline's, whether they're serving on our board or their local foundations that want to see community improvement through healthcare services at clinics like Caroline's. So our sponsors oftentimes find us because of our mission, but we are always open to new opportunities to work with companies that believe in our mission and that believe in supporting our patients, because that's really what matters most to us.
According to Caroline's Healthcare Annual Report, about 51,000 patients visited the organization, yet about 14,000 patients were served. How would the number of patients served be increased?
So I think one distinction to make here is that the 51,000 patients that visited Caroline's is actually the number of visits that we saw last year. So it might be one individual that came to the clinic 3 times. The 14,000 patients served is that individual. So we had 14,000 different individuals like you and me walk through our doors to receive care last year. And that's really the number that we're trying to increase. We have the capacity to serve more patients. We've built this beautiful clinic in the central neighborhood, specifically placed here because of the need for prenatal care, OBGYN services to combat the infant mortality epidemic that we are seeing in the central neighborhood. And so I think that it's really a matter of letting folks know that we are here in the community to serve the community, and that we have doctors specialized to treat their needs and dentists available to accept their insurance or see you whether or not you're insured. So I think that our goal is to increase number of patients, and with that will come an increase in the number of patient visits as well.
Okay, great. Thank you so much.
Thank you. Pleasure.